Well, good morning, everyone. Certainly want to welcome you to this webinar, and thank you for taking your time to attend. This is the second in a series of webinars that we've been putting on related to and focused on workforce and workforce management through this current COVID-19 crisis. The Virginia Safety and Health Codes Board adopted on July 15th new regulations as it relates to SARS-CoV-2, which is the cause for the COVID-19 virus. And I think that's going to be some of what's going to be covered today, hopefully in some detail that will be useful to you. Again, today we have Denise Tarka with Tarka Consulting, as well as Jeanne Grubbs, the Human Resources Director for GENEDGE, who will be presenting. And then after the presentation, we hope to have some discussion, some conversation back and forth. Please, as you have questions as they go through the presentation, please put those into the chat, and we'll be monitoring that and answering those questions as we can. I'll turn it over now to Denise. Denise?
Good morning, Sam. Thank you so much for that wonderful introduction, and welcome everyone who has joined our conference today. We're delighted to have a great list of innovative manufacturers, as well as some participants from the community, economic development professionals. And so we'd like to welcome all of you to this presentation. As you know, and Sam mentioned, we're picking up on a webinar that we started last month. And the title of that webinar was The 3 Ps of a Pandemic Workplace. And in the process of that, we are just continuing the conversation to see what works well and what is productive and what is new in the field of being an employer when there is a pandemic. Jeanne, you're here with me today. It's great to be back with you. I'm excited to join the team, or bring the team back together. We've got some great information on the regulations, on the way employees are feeling, and on what you as an employer can do today. So let's get started. And you know it's going to be a great presentation when we start with a disclaimer. So I basically just wanted to say we are going to be covering statutes that the Commonwealth of Virginia has now put into effect. And this presentation is meant to identify those standards for you. It is meant to give you some recommendations on how you may approach it, but it is in no way intended to be the delivery of legal advice. And we invite you and encourage you to engage with your own legal counsel in the adoption and compliance of these standards. So with that said, I want to revisit our the 3 key areas that we started with in the webinar last month. We identified that during a pandemic, employers need to be focused on 3 key areas: the physical environment, what's going on with the people, and what is going on with policies and procedures, or what needs to be enacted in policies and procedures. So we're going to go back and revisit the physical environment, but before we do that, there's a couple key points I want to make sure everyone understands, since this is the biggest update since our last webinar. On July 15th, as Sam said, these standards were enacted. They will become effective upon the publication in a newspaper of general circulation. That's anticipated to be next week. It applies to every employer, employee, and place of employment in the Commonwealth. And we're going to talk a little bit about the situations that are adjacent to this. What if you're using contract staff through a temp agency, etc. Classifications, this now requires you to classify jobs based upon their risk of being exposed to COVID. And it also has some provisions for employers and recognizing that tasks could prohibit an employee from being able to observe physical distancing from other persons. And that was one of the challenges that a lot of manufacturers brought up in our last webinar and in some conversations I've had with them since. Basically, that whole way of how do we rework our manufacturing processes, or perhaps an entire manufacturing line, because we simply can't put 6 feet between every stage. The final text is available to you. We recommend that you reach out to that. We'll give you some additional resources as we go. So Jeanne,
yes,
it's your it's your part here. Jeanne has scoured the standards, and with regards to the physical environment, we still have the same pieces in place around personal protective equipment. And we have a need for continued cleaning, increased cleaning, and so forth. But Jeanne, one of the things that you mentioned in the standard that came out was exposure risk assessments. What exactly is an exposure risk assessment? What are employers expected to do? And what should they do with the information once they get it?
Well, based on the standard, now employers are no longer they're no longer advised to take certain measures as a general. They're now required to perform a risk assessment of every job, meaning, are you able to social distance those employees? Are you able to provide the PPE that they need if there is additional PPE needed? Is their PPE sufficient to protect them from the COVID? But you also have to determine the potential for the exposure, and that's why you do the risk assessment. It's all based on that potential for exposure. If they're unable, for instance, if you have a manufacturing line where people are 3 feet apart and you can't space them out any further, which we know that is a real concern in some of our facilities, then how do you create those barriers? Can they wear masks? Can they wear face shields? Can you put up plastic shielding in between? And how much exposure do they have to outside personnel? Like if you're in a retail environment, for example, you're going to have a lot more exposure at work than someone who works on a manufacturing line who's generally with the same group of people every day.
And I think that is where this, as I read the requirements, there's a lot of great definitions that are in this. So it really brings some clarity on some of the definitions where there was some vagueness before. Some recommendations we have here. First is start with the facility-wide assessment, because there are areas of your facility that are very applicable to everyone. Your break rooms, your bathrooms, your lobbies, your reception areas, perhaps some office environments that every employee traffics through. Once you've done that facility-wide, being that it is applicable to every job, you can then go in and take the next step, which is to look at the specific location requirements and so forth, as Jeanne stated. If you recall in our last webinar, and that video is available from GENEDGE, we talked about touch points and talk points, and where can they be in physical contact that would create some type of a exposure, and where would they be talking in which that virus can be transmitted. So with that being the case, revisit last month's webinar and look for the specific potential for exposure in both touch points and talk points. Jeanne, any other thoughts or recommendations on this risk assessment that employers are required to do?
No,
Okay.
I think you've covered it.
I think we've also got the potential to look at some of the OSHA requirements that may be in your job descriptions, because those are identifying hazards, and these hazards can be similarly identified. So let's move then to our second point, and this is to the people. And this is the part that in the first webinar, we talked a lot about compassion and communications and caring, as well as providing supplies, making sure they're known. And I went to the Gallup organization because they do some wonderful research on employee and the employment arena. And what we found is that between the middle of May and the middle of June, there has been a noticeable or marked decline in the employees feeling prepared and ready to make either return to the workplace or to make their job feel that they're safe and provided for. As you can see in each one of these, the green bar is the designation in mid-May, the black being mid-June. Communication of clear plans, we've seen a decline. Do they feel well prepared to do their job? There's again an approximate 10% decline. Does the immediate supervisor keep me informed? We see again about a 10% decline. And does my organization care about my overall well-being? We have a 9% decline. What this is telling us as we read into these numbers is that these employees are coming back to work, and they're starting to feel like the news, what they've had personal exposure with, what they have learned, that all of a sudden they felt, okay, coming back, we're going to give this a shot. But now they've given us some great places in which employers can step up. And I think communication is a critical need that we visited last month in the webinar. And I think, again, it keeps coming up, and we see some real statistics here of how employees are feeling more and more uncertain. Now, for those of you who were may not able to join us last time, we talked about really how that employee engagement affects the bottom line of an organization. So companies now that are coming off a 3 to 5 month period, decreased revenues or declined productivity, the idea in having employees come back and feel safe and feel clear communication and all of those things really has a bottom line impact on your business and your organization. So this goes one step beyond being gracious employers, and it's really being strategic and smart employers that see the integration of employee engagement with bottom line orientation. Jeanne, any thoughts on what you've heard with employees and their perceptions coming back?
No, what I've heard most of all is there is a real fear, particularly as cases are climbing in some of the states and in the Commonwealth. I know in our particular region of the Commonwealth, our cases have been, we're now one of the 10 hotspots because our cases have been climbing so exponentially this last couple of weeks. And that's making a lot of the employees nervous. And this is where it is key that leadership can really go above and beyond to help that comfort level and to make sure that that communication, those lines of communication are open, that your employees feel like they can tell you when they have a concern and they feel like you're going to listen and you're going to address the concern.
Yeah, exactly. And I think one of the good things, as I saw when reviewing these standards, is that some of the requirements for employers feed directly into this. So while we're about to adopt some more requirements, it's going to create some more work. They're really also going to help with this area of employee engagement. All right, policies and procedures. This is where it gets really interesting. We know that these standards came out and there's some mandatory requirements. I want to touch on those at a high level, and Jeannie's going to come in and talk to us about some specific policies, procedures, and program. The mandatory requirements, and on the right-hand column, I've referenced the section of the standard that it is related to. All employers must conduct a workplace assessment. The standard talks about assessing the workplace, classifying the jobs, and informing the employees. And Jeannie's going to go into that in a little more detail for us in a few moments. Secondly, this prohibits serological or antibody testing as a standard for returning employees to work or for involvement in congregate settings. So let me explain that. A number of people thought, well, we'll just have employees tested. If they show up with the antibodies, we will allow them to be able to return to work, or that they can come into a congregate setting, which would be some kind of an event, like a seminar or any kind of a group event. What the determination is in this standard is that because we don't know that antibodies prove there is immunity, an antibody test cannot be a standard in determining return to work. Jeanne is also going to talk to us about what the standards are to be used as you write return to work policies. All employers have now a requirement to have policies and procedures in place when someone has symptoms and no known diagnosis, so that they are suspect of it. Now, this is an important point because we are rounding the third base of summer and we're heading into flu season. And anyone who has children knows that September comes and there's runny noses and lots of coughs. And in this particular instance, somebody may have influenza, and yet we are required to consider them suspect for COVID-19 unless they have been tested and don't have a positive test. This policy and procedure requires you to look at reporting. Jeannie's going to talk to us about some reporting requirements in a few moments. And then it also makes it impermissible to have any employee, subcontractor, contractor, client, vendor, remain on site when there is suspicion, and they can't return until they have been cleared. All employers are also now looking at requirements with having sick leave policies that are considered flexible and consistent. This references public health guidance and Family First Coronavirus Act. We've got applications now or implications for subcontractors and contract staffing agency, similar requirements to employees. Employers need to design systems for reporting and notification. What's interesting about this is that they need to design the system in such a way that if there is a positive test, they have the ability to look 14 days previously from the date of the positive test. So basically that is 2 weeks prior to the date of the positive test. And you need to be able to have some reporting information. What's important to note here, you'll also see in the standard, is that there is no requirement for you to then, beyond notifying who was there, do any contact or tracing. That is not the employer's requirement, but it is your requirement to notify the people that were there within that defined period. And the last mandatory requirement is that all employers are required to make it available to employees their own medical records, access to. Now, I put ADA on here and HIPAA. We've got some considerations because, as we mentioned last time in the webinar, the Americans with Disabilities Act provides provisions and protections, and the HIPAA does with reference to all of the records. Everything that we are collecting here and all this information, and especially when it comes to reporting, there is a requirement that the identity of the infected or suspected infected person is kept confidential. So employers need to, again, go back and look at their systems and make sure that those confidential requirements are being maintained. The next thing that we're going to take a look at is the notification requirements. And Jeannie, I'm going to let you speak to this.
Okay, so if you have a positive COVID case in your facility, you are required as the employer to notify the Virginia Department of Health within 24 hours of discovery of the positive result. You are also required to notify the Virginia Department of Labor and Industry if you have a discovery of 3 or more employees present at the place of employment within a 14-day period testing positive for COVID-19 during that 14-day period. So in a 2-week period, if 3 of your employees have tested positive, that's when you would be required to notify Virginia Department of Labor and Industry within 24 hours of discovery of that 3rd positive test.
And these are not mutually exclusive. So if you have that first one, you report it to the Department of Health. If you have the second criteria, not only is that reporting to Labor and Industry, but you also need to make those other cases informed to the Department of Health.
Correct.
So with this being the case, again, this requires employers to look at systems, documentation, record keeping, and make sure that these contacts and these reports to these respective organizations are also documented and kept as part of your records for this year. All right. So when somebody's coming back to work, this is a big thing. And we talked about this in the last webinar because we explained how people coming back, in addition to having dealt with a physical illness, or in this case now a suspected physical illness, sometimes they're bullied, sometimes they're ostracized, sometimes, they're coming back and they're not feeling well. And we know from what the medical profession is saying, some people, it will take months for them to feel back to work at the, back to physically feeling at the levels previously. With that being the case, policy requirements, but we have to remember this exists in the context of what we talked about last time, with regards to the culture and the environment around an employee returning. So Jeannie, tell us about these work policy requirements for returning to work.
So the requirements now, prior to this standard, the requirements were generally, and they weren't requirements, the suggestion was generally, if you had someone who was known or suspected, you sent them out for 2 weeks, they could come back after 14 days. Now, however, all employees have to develop and implement a policy that allows for symptom-based or a test-based strategy prior to return to work, and I'll explain those as we go through. A symptom-based strategy precludes employee to return to work for 3 days from the recovery and 10 days from the appearance of the symptoms. So you've had an employee who was symptomatic and was out. They have to be 3 days with no fever-reducing medication and no fever, and 10 days from the first appearance of those symptoms. So if someone had symptoms last Wednesday and they have had the last 3 days with no fever, they're still in that 10-day window. You would have to keep them out for the remainder of this week until they could come, till they meet that 10-day requirement. The test-based excludes employees from returning until the resolution of the fever without fever-reducing medications and improvement in respiratory symptoms. Now, these are for symptomatic cases, known or suspected. And they have to have the negative FDA emergency use authorized COVID-19 molecular assay tests from results from 2 respiratory samples taken 24 hours apart. So not just one test that says they're negative, they have to have one, and then the next day they have to have another one that both say they're negative, and then they can return to work.
And I think this is a great time to stop for a moment and link this to staffing levels or link this to production levels. With this being now known and suspected, and again, going into flu season, there could be someone who has the flu, and because we have a lag time in the testing, and it can take 7 to 10 days to get a test back, someone who has influenza may be out going through this process with influenza and being out for these same number of days while waiting for that test to come back, subsequently needing a second test within 24 hours. So really the implication of this and the coming influenza season, requires employers to strategically be thinking, what happens if flu goes through my business in addition to COVID-19, especially in the consideration of the time it takes to get that COVID test and the related results. Any other thoughts, Jeannie?
One of the things that I found interesting is that with the test-based system, your test-based strategy, if an employee refuses the test, you can refuse them to return to work until they have met the symptom-based strategies. If they refuse. Also, employers cannot make the employees pay for the tests. The employers have to pay for the tests.
Okay. Those are important points to remember as well. All right, so let's talk now about what happens when an employee who is asymptomatic but known to be infected. So this is someone who's tested positive for COVID, but isn't showing any signs. What is their return to work policy like, and how is it similar or different to the prior policy?
So with an asymptomatic employee who is known to be infected, again, you have to base that symptom-based or the test-based strategy. Symptom-based, again, precludes the employee to return to work for 10 days have passed since the date of their first positive test. So even though they have been asymptomatic, that positive test is where you would use, instead of the start of the symptoms, because they've been asymptomatic, you would use that first positive test, unless they develop symptoms following the test. And that's where you would go back into the prior policy because now they've become symptomatic. The test-based strategy excludes employees from returning until a negative FDA emergency use authorized COVID-19 molecular assay test results from 2 respiratory samples taken 24 hours. So it's the same. It's that symptom base that changes. And it just changes on whether or not they develop symptoms after the positive test.
And if they do, you go back to policy number 1 because they've now have become no longer asymptomatic and they align with that policy requirement.
Correct.
Again, you know, heading into flu season, there's some different implications to this that we've already reviewed. Any other thoughts on asymptomatic employees and their return to work, Jeannie?
No.
Okay. So there are some applicable policy requirements. Jeannie touched on these. We cannot require employees to pay for the testing. And then nothing in this prohibits the employer from requiring the employee who is infected to be tested. You know, you can make that a condition. You can't return to work until you've been tested. And that brings forth then some new policy considerations. One, employee attendance tracking. Employers will need to know who was on site and potentially exposed in order to meet that 14-day previous requirement. Your policies, again, need distribution, and they need to be reviewed with the employees in your standard format and process. And we recommend, again, that you continue to ask for and require an acknowledgement of receipt. And where appropriate, incorporate these into an employee handbook. On the first page of this of the standards, it says these are emergency standards adopted 6 months with the potential that they can become law going through the appropriate processes. So you want to continue to watch these. These will kind of shift and change and may shift and change. But right now, these are the emergency standards that were put into place on the 15th of this month. All right, Jeannie, this is a big one.
Yes. So the infectious disease preparedness and response plan. Most places generally have not had to have anything in place for that unless you were in a medical setting. And of course, anyone in a medical setting has always had to do this. This is second nature. So who is responsible for doing this? Employers with hazards or job tasks classified as very high or high, which very high is you're dealing with COVID-19 patients. You're in the medical field, you are treating those patients. You have them in the ICU, you have them in your emergency room, you're considered very high. High would be the more people in the medical field who are at risk because of their medical field. Typically, those jobs are medical field jobs. Or medium with at least 11 employees. So a small office with 3 or 4 people that's considered a medium risk because you deal with the public, but you only have 3 or 4 employees. You're not required by the standard to produce an infectious disease preparedness and response plan, to develop it, a written one. It's a good practice if you're a medium risk, but you're not required. But those employers with very high, or medium with at least 11 employees are required to develop a written infectious disease preparedness and response plan. Designate a person responsible for administering the plan. All employees, regardless of the risk classification of potential exposure, within 60 days must be trained on this response plan. And compliance with VOSH standards, with the Virginia Occupational Safety and Health standards. These are required.
Now, going back to the question of employers with jobs classification, that goes back to the first section, the mandatory requirement that every employer go through and classify the job. So the information from that continues to be used at different points throughout these standards and in the workplace.
Yes.
Jeannie, any thoughts? Anything else on this?
No, not at this time.
Okay. So now what I'd like to do is continue the conversation, and we're going to open this up for questions. And we'd like to also, just before, well, let's go to questions and then we'll wrap up at the end. Yes, Mindy, are you going to field questions?
Certainly. So we did have one question come in, and Bill Presley asked, will the slides be available after the presentation?
Yes, of course. We'll make those available.
And we'll also be sending out a recording of the webinar, and it will also be available on our YouTube channel.
And we'll make sure to include in the email that goes out a link to where these standards are published so that you can access the standards directly yourself and review them as well. What other questions?
That is our only one right now. I guess we can give it a couple of minutes and see if anyone else wants to ask a question.
I'd like to kind of pose a question to the 17, 18 participants we have with us right at this moment. Tell us, what has been your biggest challenge in adopting your employment or your workforce to the COVID-19 pandemic environment? And if you could tell us that in the chat box, we would love to hear your answers. Anyone offering any answers, Mindy?
We haven't had any feedback yet. Oh, yes. So Lauren Sodell asked, are the expectations for flexible sick leave policy the same for both FLSA exempt and non-exempt employees?
If you read the standard, it says that they have to comply with the coronavirus Family First CARES Act, and they need to be in line with the health department regulations and with wage and hour laws. So as long as your current flexible policies comply with the wage and hour laws, adopting them to the other two should bring you into agreement. Also, I encourage you to reach out with that particular question, because with the wage and hour laws, there's so many different exempt hourly, non-exempt hourly, exempt salary. You've got so many different classifications. I would reach out to the Department of Labor. Their website has some great information on it with regards to that.
Okay, we've had a couple others that have come in. Let's see, so Mike Levy says, one pattern and frustration I've noticed with some of my clients is they're frustrated with clarity on regulations and they don't know when and how to keep updated on clear mandates. Another one that came in says VOSH is working up some documents to help employers, such as templates and sample documents. Would recommend you help make them available to your participants.
That's a great suggestion. There are also the site where the standards are published. There's also some templates there as well. So we will make sure to capture those and include them in that email. Thank you for that recommendation. Back to the comment about the inability to stay current on all of these requirements. I think, as we mentioned, Jeanne said this so clearly in the first webinar, we really right now are dealing in that fluid environment where all the balls are in the air, and there really isn't any one place. Well, there isn't really one guarantee on any of this right now. These are emergency standards. So in the next 6 months, some may become law, some may be amended to not be. The question, if you have the magic 8 ball, please share that, because that's the challenge so many employers are facing. A couple places though where you can really stay focused, and I think we had these resources last time, the Center for Disease Control, the Department of Labor, any of your state websites, the Employment Commission, the Virginia Employment Commission, the Commonwealth's website, all of the places that are touching on any part of this have websites that are usually pretty current. And again, we've even seen in the media the challenges with current. So understand that there is no perfect standard or any perfect answer in place right now, which is why I believe and recommend that documentation be important, because that helps us to show a good faith cause. In fact, there is one place in the standard where it states that if a state is not fully enforced, but the Center for Disease Control requirement had been met, they would view that as a good faith effort. So when you read this, go back and look at that to say, you know, if we're not 100% in compliance, but we're doing what the Center for Disease Control and public health recommendations are, we are showing our good faith in doing that as well. And again, I mean, this is a really challenging, difficult time. I engage with businesses all the time, and I hear the same frustrations that come from lack of clarity and the information changing. And you can ask the same question twice on the same day, and you might receive different answers.
We
what's
had
next?
we had someone else say getting all employees on the same page of what the rules are. Company state information on Facebook.
Mindy, can you repeat that last part? Companies
Yes.
on.
So it seems like they're posting company and state information on their Facebook.
Okay, the company's doing that?
I believe so.
I read that differently.
Okay.
And I
Can
think,
you hear me?
yes, we can.
Yeah, I'm the one to put that in. This is Bill Presley. One of the things that we struggle with is our employees taking upon themselves to interpret what the rules are. Even though we put out correspondence that we believe is very clear, they hear things on the news of what the new guidelines are, or they hear stuff on Facebook and they come up with, well, I don't have to do this because so-and-so said this on Dateline, or Facebook said that this is the new state rule. And so we have a lot of, issues with trying to maintain a consistent message of what the guidelines are within our facility and keeping all the employees on the same page. Even though that we have it loud and clear, there's so much information going out there that we do have our employees who like to be creative and try to tell us what the rules are, or contradict what we try to put in place. And that's kind of what we struggle with. We are managing it, but those are just some of the things that we've seen during this time as it's evolved, because we've been under these restrictions for quite some time.
Mm-hmm.
And then employees tend to get laxed on well, hey, it's not affecting us yet. Why do we still need to do this? Because I heard this. But yet then again, now, cases are increasing, rules are changing, and, we try to have a clear communication to the employee workforce, but it's difficult because people hear things differently.
Right.
Yes.
And Bill, can you recommend, or do you have any recommendation for the other employers on the call today as to some of the strategies you've used successfully to manage that?
Yes, we've had, employee, small group stand-ups, of course, maintaining the social distancing. We are putting out, company communications, virtual all hands where they can dial in from their workstation. And so we don't have to congregate in one big location, and just repeating over and over what the guidelines are. Trying not to be a police, but
Right.
yet, be, just in keeping our employees that, hey, we're not doing this to, pick on you or make your life hard at work, but we're doing this because we want you to be safe. We want everyone to have a safe workplace to come to. And, oh, by the way, we don't want an incident where we have to send people home, because if someone does come that does, find out that they're positive, then you have to look at first contact, and you can almost send a whole department home, and those people may not have time off to take.
Right.
And so you have to be considerate not only for yourself, but your fellow employees. and getting that message across is very important so that people feel that it's not just them, it's the people that they work around. And so wearing a mask is very important. Wearing it appropriately is very important.
Yes.
Maintaining your social distance is vital. Because just because you have a mask on doesn't mean you can go hug somebody. So those are the things that, you know, we need to stress, and we have been stressing within our workforce. But, you know, you run into situations where you have family and relatives or people who work, you know, live in the same household that think that at work that they can practice different things.
Right.
No, you have to maintain the guidance and everything, because we want to keep our doors open.
Right. And Bill, thank you. That is a wealth of information. And especially the point about families living together, they would continue to exist in the workplace as they were doing at home. I like also what you said about that repeated communication. I know of a company right now who has adopted the press conference daily approach. And they have their CEO sends out a video, and this is not a manufacturing company, so it's a little easier because they're all in office or office type environments. But the CEO sends out a video every day saying, okay, we didn't, you know, yesterday we didn't have any exposure that, you know, we're aware of, but we want to make sure you still wash your hands, wear your masks, etc. And the employees have actually started to take well to these. This particular CEO has a little bit of a sense of humor, or he thinks he has a little bit of a sense of humor, but he's kind of turned it into some endearing messages for the employees as well. So Bill, I love what you said about saying we're caring for our employees. And I think right now that's what they need most. Thank you so much for that valuable input. Mindy, go ahead, Bill. Did you have something else you wanted to share?
Yeah, and another important thing is that, you know, you got to control the rumor mills. If someone's out, you know, because, you know, it could be just for a personal reason, you know, people want to know, hey, are they affected? And there's that confidentiality. And, you know, we kind of explain to people, hey, before people took vacations, people, you know, stayed home because of family situations, you know, doctor's appointments, things of that, doesn't mean that they're infected in everything. And by the way, the company is not going to let them in the building if we know they have symptoms or if they have a fever. And we are doing what we can to, you know, to the best of our abilities to maintain the safety of our workforce. Don't start, you know, keep the chatter down.
Right.
We don't need the rumor mills going around saying, hey, so-and-so's not here. Oh my God, you know, let's treat him like he has it she, and just because they were out one day. People are starting to get a little bit more, you know, at unease because of it, because more and more people are now being effective or know someone who has been affected, and it's becoming more real.
Exactly. And I think as we see play out some of what has been a story on TV, now it's playing out in our communities, and it's hitting closer to home. And I think the control the rumor mill is one of the, if you walk away with a really great nugget, control the rumor mill, because you also have to remember as the employer, you've got those needs to protect the confidentiality of that employee's medical information and so on. And the rumor mill can precipitate violation of that confidentiality. Not that the employer's doing it, but just that you want to make sure that the less conversation about it, the better. Thank you. Thank you very much for that. That was wonderful. Mindy, what else are we hearing from our group here?
Let's see. Mike Levy says, also with many of our small manufacturers, because they are small, lack of formal marketing and communication processes and an owner of that process, like a communications director, so they experience gaps in their abilities to communicate with their employees and update their employees in a planned, controlled manner.
Exactly. If you don't have that marketing communications piece, or if you don't even have the human resources function as a defined function, those communications can become challenging. I want to go back and mention in our last webinar, we talked about some great places where you can get print-ready postings. The more you make the message available in your workplace, the easier it is for reinforcement of that message. So if you haven't done anything with adding those postings, that's one way where you can keep that message present. Bill gave us some wonderful ideas. I think the idea is that, and again, I know owners of small manufacturers are busy, but I think the leadership at the top would be driving that message. And there's easy ways in which that can be accomplished. And so please reach out. We're going to give you an email in just a moment. If you're having a problem with those communications, please reach out and we'll see what we can do to help you with a solution to increasing or making consistent your communications with employees.
Denise, I would also recommend posting the BOSH standards. Just like you post the EEOC standards, post the BOSH standards. There's nothing that says you can't post them. They're not confidential.
Right.
Post them, and the employees can then go read them for themselves. And if they're not clear on something, have that open door that they can ask those questions, that if they're not clear.
Or even walk around and ask the employees, you know, just say to them, have you read it? And tell me, do you have any questions about it? Or, you know, cover the content in a conversation piece. Absolutely. You know, when I think back to the Family and Medical Leave Act and, you know, and back to the early 90s when we had the ADA and then we had the FMLA, and a lot of the best education of employees was just that conversation one-on-one with the supervisor, the manager, or the executive. So let's not underestimate, because we're talking through a mask, the effectiveness of what we're saying or are capable of saying. All right, Mindy, anything else?
We have not had any other chats come in at this time.
Okay. Any other comments that anyone wanted to share, or can I open the floor for just a moment? If anyone's participating and would like to jump in and share some information, you're welcome to do so.
Sure, this is Bill again. I hate to monopolize this, but just to build upon what you said about a mask and facial expressions, one of the things that we are looking into in pursuing is they do now have these masks that are clear. So because we do have an employee that is harder of hearing and reads lips, and we've noticed that that would be something that would be good for the group that employee works in. And so it is an option, especially if you're in a type of environment where, you know, facial expressions are important, such as teaching or even you know, sales or marketing, where that verbal or that nonverbal communication is important. There's an option.
Right. That's a great idea. In fact, this next time we're going to come up to our next conversation in just a moment. Bill, we would love to learn more about what you're doing with that, because that's also accommodating a disability. So in the midst of our trying to deal with COVID, we're still trying to accommodate employees who need special cases like that. So thank you for that example. That's a great example. Mindy, any other thoughts or comments that have come in just the last moment?
We haven't had anything new.
Okay, would anyone else like to join the conversation and share? Okay, so then just to kind of wind down this conversation, I'd like to leave you with a few thoughts, invite Jeannie to do so, and then we have continuing the conversation coming up next month on August 20th. It'll be from 11 a.m. to 12 p.m. Much like today's conversation, we'll give you an update. Some of the topics we'll be focusing on is unemployment compensation, because the additional $600 is scheduled to, at this moment, go away at the end of this month. We don't know what's going to come to change that. And again, more change coming. So we'll have that as part of the conversation. We'll talk a little bit about recruiting in this environment. As we mentioned in today's program, we've got flu season right around the corner in addition to COVID. So we'll look at some suggestions on how you might go about recruiting, some ways in which you can look at some alternative staffing practices. We'll put a couple highlights on that. We'll be coming back to talk again about how employees are feeling about the workplace, look at some of what's going on with their engagement. Are they feeling more engaged, less engaged, with what changes in the pandemic in the world and in their lives? Jeannie, do you have anything you would like to add as we conclude today?
No, I just thank everybody for coming again today. Some of you, I recognize names from previous webinars. And so it's great to see you back. And please get the word out if you know other people that might be interested, and make sure that they do check out the YouTube channel.
And then lastly, if you have any questions, if you'd like additional information, please reach out to Sam. He's our Regional Growth Manager. His email is swolford@genedge.org. Any questions, if you have a topic you would like covered in the next webinar, please send that to Sam and say, hey, that would be something I'd like to learn about. If you would like to participate in the webinar and share some of the great things that are going on, we learned from Bill that there's amazing things that employers are doing that are innovative, that are adaptive, that are exciting to listen to, that touch on places and points that no one person do. Together we're stronger in all of this, and we invite you to share in that way. With that, and without any further ado, I too thank you for being here with us again. I look forward to seeing you back here on August 20th as we continue to adapt to the changes of being an employer in a COVID-19 pandemic environment. Thank you all. Stay safe and have a great day.